Hello, good afternoon, good evening, good morning. Wherever you're viewing this from, it's still me, Golden Fresh. Today we are quickly going to dive into something. Let's treat this topic, heart attack. I know that we all know about heart attack. Everybody knows. There is no one in this country that doesn't know what heart attack is. But I want us to quickly say something. What causes heart attack? What to do when you notice that someone has heart attack, and then how to prevent it. So guys, keep watching. Let's quickly dive in. First of all, before we start anything, I want to quickly define heart attack. What heart attack means. Heart attack or myocardial infarction is death of part of heart tissue. That is in the body is made up of tissues and cells. Group of cells are called tissues, and the part of that, let me say, like this is an organ. The nose is an organ. I'm using it as an instance. For the heart, a heart is an organ too. When a part of the heart dies, it dies as a result of maybe, let me say, less oxygen, less nutrients. That's what kills tissues. So they say that heart attack or myocardial, if you didn't call it heart attack, you call it myocardial infarction. MYOCARDIAL is death of part of heart tissue, leading to severe chest pain, breathlessness, and loss of consciousness. This heart attack is a major cause of sudden death. The sudden death that happens around heart attack is a major cause of it, but people don't know. So let me quickly say what causes heart attack. Heart attack is caused by blockage of the arteries. That artery that supplies blood to the heart. It can be blocked with maybe, let me say, fatty substances like cholesterol. Cholesterol causes heart attack. The blocked area of the heart stopped to receive oxygen. That area that maybe the cholesterol blocks. When the cholesterol blocks that artery, oxygen no dey pass that side again. Meanwhile, all the tissues and organs in the body need oxygen. Other things like nutrients can pass through there too because of the blockage. Then the blocked area of the heart stops to receive oxygen, dies, and stops to function. When the area dies, it stops to function. The obstruction may be partial or complete, it depends, resulting to unnoticed or noticed attack. So they say that the obstruction may be partial or complete. It's depending on the size of the blockage, what blocks the artery. If it's a little substance, so the area will be partially blocked. When it's a huge mass, so that place will be completely blocked. Another thing I want to let us know is that heart attack is not evil attack. And then send all these people that say, hey, oh, any heart attack, we think that heart attack is something sent from our great grandparents or witches and wizards. Heart attack is a disease on its own. It's not an evil attack. So let me quickly dive into type of heart attack. Heart attack can occur unnoticed or noticed. So there are two types of heart attack. The noticed one and the unnoticed one. Let me explain about the unnoticed one. Unnoticed heart attack occurs when there is little or partial obstruction of the blood vessel. when when the obstruction is partial, when the stuff blocking the artery is a small mass, you understand, that is when unnoticed heart attack occurs. It occurs silently without obvious sign and symptoms. It doesn't show any sign, it doesn't show any symptoms. It is only apparent in heart examination. It can only be observed when maybe somebody run test like electrocardiogram. That is the ECG test we all know. Then let me go to the noticed heart attack. This type of heart attack is obvious, manifesting with its signs and symptoms. So let me explain how this heart attack occurs, how it shows, how to know that somebody has heart attack, the symptoms. Heart attack presents with the following conditions, like severe chest pain, like feeling pains behind the breastbone, the chest, like this area. You'll be feeling a lot of pain. By that time, you have to go for this ECG test to check the quality of your heart, if your heart has any issue. That is number one sign. Another one is chest tightness. Eba gane kechi gekechi. It will be as if they are like suppressing your chest. That is the chest tightness. The other one is pale or green color of the lips. These are signs of heart attack. Lips, that person gana acha miri. That is what we call pale. When somebody is pale, that person eba gana acha miri. Or grayish. When you see sweating or clammy skin, ogobla, heat, even when there is cold, heat, restlessness and dizziness. All these are signs. For sign in there, you have to go to the hospital for checkup. Another thing is breathlessness. That person will be finding it so difficult to breathe. Rapid weak pulse. If you feel the person's pulse, God is so weak. You won't, sometimes they are different. You won't even get anything from the radial artery to feel the person's pulse. Then another thing is loss of consciousness. That person gonna be unconscious. Now, let's go to some certain factors that can lead to heart attack. The first one is age. Like age of 45 years and above, with age, certain disease occurs. Heart attack can be one of them. Then another thing is gender. Men are in high risk of heart attack, but women have lower risks because they have some protective hormones like estrogen. But during menopause, because those hormones are no longer there, they are also in equal risk with men. Some other things are like family history of heart attack. If your mother or your grandparents have history of heart attack, it's also genetically. The disease can be genetically gotten. Another thing is high cholesterol level. If your cholesterol is above 140 to, let me say 300 ml per 100 milligram, it's high. You need to reduce fatty contents. Another thing that causes heart attack is smoking. Those that smoking, those smokes can also can also block the artery that sends blood to the heart. Smoking can lead to heart attack. Another thing is overweight, obesity. Obesity can cause heart attack because it's something like a cumbersome like tissue in the body, fat everywhere. So obesity can cause heart attack. Another thing is hypertension, high blood pressure. Another thing is diabetes. Diabetes can cause heart attack because diabetes has to do with the blood vessels and the heart. That will be in the topic of next time. Diabetes can cause heart attack. Stress and lack of exercise. Lack of exercise can cause heart attack. Rest. No dey walk like elephant every day. Body no be firewood. Make sure that your time of rest is greater than your time of work. You get why? Now let's go to how to prevent heart attack. 1. Regular checkup. Dey go checkup. At times, these days now, people don't no longer go to checkup. They use money to make excuse. Life has no duplicate though. Your life no only one. If you lose am, you don't lose am. All your investment, another person will take it. So at least yearly, be going for clinic for checkup to run certain tests to see if your body has gotten anything can happen. Secondly, stop smoking. If you're a smoker, stop smoking. Smoking can cause, it's not only heart attack that smoking cause. Smoking can cause even lung cancer. Stop smoking. Quit smoking is not good. Another thing is keep healthy weight range. Keep checking your weight. There are people here that eat junk food. They are not good for your body. Eat something that is nutritional, like food that's green vegetables, stuff that can be of positive effect to your body. Stop eating junks, tinned food, canned food. Another thing is control and manage your hypertension and diabetes. If you know that you're hypertensive, keep monitoring your hypertension. Keep monitoring it. Then if you know that you're diabetic, keep checking your sugar level, because if anything happens, it can also cause heart attack. Another thing is eat low fat and low salt diet. Stop consuming ababa. Consuming much fat causes heart attack, cholesterol, which can cause heart attack. Then salty content. Salt, consuming a lot of salt. Like let me tell you something that you don't know. If you are the age of 40 and above, or as you're aging, the more you age, the more you reduce hand in salt content. Salt causes BP. When BP ran, when BP agbago, salt has effect in increasing the hypertension. Then diabetes. Diabetes is sugar. Taking much sugar and salt. Quit it. Then regular exercise. Be exercising regularly. The more you exercise, the more you burn fat. The more you exercise, the more you burn fat in your body. Then another thing, stop stressing yourself. Reduce stress. Get time for yourself. Rest. Rest. Now, what to do in a suspected case of heart attack? See that somebody has heart attack with all these symptoms I've mentioned before. What to do in that case? Do not run away from the person thinking it's an evil attack. I keep saying it. Heart attack is not an evil attack. It's a disease. It's not an evil attack. So if you see somebody that has heart attack, don't run away thinking it's an evil attack. Help that person by sitting the person upright. If I'm be sit the person upright. Do not give anything through the person's mouth, because Onyangana is unconscious. That person will be unconscious. Do not give anything through the person's mouth. When the name no matter, dizzy. Through the mouth. That person can choke and from there. You understand? Rush the person to hospital for quick clearing of the blockage to prevent permanent damage to the heart, which may result to death. Immediately that you have sat the person upright and you've not given anything through the person's mouth, you rush the person to the nearest hospital so that if there is any blockage in the breathing, in the airways, it can be cleared. If there is any blockage, it can be prevented at that time, so that the permanent, if it's permanent, that person die from there. Then if the person is unconscious, commence basic life support. If that person is unconscious, there are basic life supports, like there's something we call cardiac massage. The one that person is totally unconscious and the heartbeat is like going somehow. They call this cardiac massage. You know, massage and a heart, yeah. As you're doing that, you'll be doing, if maybe the person is your close relative, you'll be doing this mouth to mouth air respiration, something like you put your mouth on the person's mouth, on the person's whole airways. You're introducing air, oxygen into the person. Or if there's any nearby oxygen reach, you reach for the oxygen. So guys, this is the end of the topic for today. If you have any question, drop it at the comment section. If you have any topic you want me to treat about, drop it at the comment section. Make sure you follow my page. Make sure you like my Facebook page. Make sure you follow my YouTube channel. Make sure you follow my TikTok channel. Thanks guys. Thanks for watching. See you next time.